AndroPauseSpecialist.com, Section 1. Understanding Andropause. You're experiencing low sex drive. Your energy level isn't up to par, and your strength isn't what it was. They're conditions that occur in any aging male, but they're also related to a drop in hormone production. And that's what andropause is all about. It's been known for a long time that male hormones produced in the testes reduce as men get older. But lately, more attention is being paid to what can be done about this condition clinically. Whereas men used to shrug it off as an expected part of the aging process, physicians are now discovering medical solutions to address these symptoms of andropause. Symptoms of andropause. As we've said, andropause is not a sudden condition. It creeps up on you gradually. You might detect the onset of andropause symptoms if any or all of these occur. Low sex drive and erections not as strong as they were. Nocturnal erections don't happen as often either. Mood changes or depression. Insomnia or other sleep difficulties. Low energy levels. Lean body mass reduces along with muscle mass and strength. A loss of body hair. Bone density decreases resulting in osteoporosis. Osteoporosis can lead to the occurrence of bone fractures and breaks. An increase in fat around internal organs. Understand that these are symptom guidelines. Andropause affects different men in different ways and to different degrees. Some men get one or two of these symptoms and may just notice the other andropause symptoms occurring minimally or not at all. As you work your way through this website, take the ADAM questionnaire if you're concerned that you might have andropause. It's a simple and effective way to detect this condition. Now, just because you have some of these symptoms doesn't necessarily mean you have andropause. It could be some other cause, so a blood test is the best way to make a diagnosis. To test your symptoms of andropause, take the ADAM questionnaire. There are 10 yes or no questions here to help determine if you have andropause. Submit your answers via the internet. ADAM questionnaire: androgen decline in the aging male. Do you have a decrease in libido or sex drive? Yes or no? Do you lack energy? Yes or no? Is your strength or endurance decreased? Yes or no? Have you lost height? Yes or no? Have you noticed decreased enjoyment of life? Yes or no? Are you sad or grumpy? Yes or no? Are your erections less strong? Yes or no? Have you noticed a recent deterioration in your ability to play sports? Yes or no? Do you fall asleep after dinner? Yes or no? Has there been a deterioration in your work performance? Yes or no? Positive result. If you have completed the ADAM questionnaire and received a positive result, you might be suffering from andropause. The only way to definitively determine a diagnosis is to visit a specialist. A blood test is needed to diagnose andropause. After the age of 50, the average testosterone level decreases at a rate of approximately 1% per year. However, if only absolute testosterone levels are evaluated, many patients with andropause will be missed. There may be an increased level of sex hormone binding globulin that binds the testosterone and makes less of it available to the tissues. Also, as men get older, there is less of a daily rhythm to the secretion of the testosterone. Younger men have higher testosterone levels in the morning, which then decrease as the day wears on. In older men, this curve is flattened, leading to steady low levels of testosterone throughout a 24-hour period. Here are some issues regarding testosterone that are important to remember. It is not yet known what level of serum testosterone defines a deficiency in older men. Generally, it is accepted that 2 standard deviations below the normal values for young men is considered abnormal. A man may have large variations in his serum testosterone levels over time. He may have normal testosterone levels one day and have decreased testosterone levels the next, so it is important to look at hormone levels over a period of time. In older men, affected organs may respond differently to androgens. Not all men need the same level of testosterone to maintain proper function of their brain, bone, prostate, or muscle cells. Therefore, it would be incorrect to say that there is one standard level of testosterone that should be achieved by all men. Rather, the patient and the physician, working together, need to find the level of testosterone that is most effective for the particular patient. There remains significant controversy as to how best to measure testosterone levels and diagnose andropause. It is well accepted that if total testosterone is less than 200 nanograms per deciliter, a man will be diagnosed with a low testosterone level. If his total testosterone is greater than 600 nanograms per deciliter, low testosterone may be ruled out. Currently, it appears that the best measurement of androgen status is either free testosterone or bioavailable testosterone. However, these can be measured in different ways. The analog-free testosterone method is the most commonly used in the United States by most large commercial labs. It is not considered a very accurate way of measuring testosterone. These measurements may only be available through specialty laboratories. It is important to remember that there is significant variation in the recommendations of what tests should be used to establish a biochemical diagnosis of andropause. However, it is widely accepted that the blood work should be done in the morning before 10 o'clock to capture the potential peak values. Since testosterone interpretation is such a complicated field, it is helpful to see a specialist for an andropause diagnosis. These experienced physicians have a relationship with a specialty lab, as well as the experience to interpret these complicated results. Negative result. You will receive a negative result if you answered no to questions 1 and 7 and you have less than 3 positive answers. If you have a negative quiz result, you are probably not suffering from andropause. If there are symptoms that are causing you concern, check with your physician. He may be able to help you determine what is going on with your health and determine if you need to see a specialist. Andropause diagnosis. Blood tests measure testosterone levels in diagnosis of andropause. To determine if you have andropause, a blood test is necessary for measuring testosterone levels. While it's true that decreased testosterone levels are a factor, other issues may weigh in. For instance, more sex hormone-binding globulin may limit testosterone from traveling to the tissues. Also, where testosterone levels would rise and fall when you were younger, you may now be experiencing a flattening and lower level of production. A few issues you should be aware of. The definition of low testosterone varies. Generally, 2 standard deviations below the usual rate for a younger man is considered deficient. It's important to look at your testosterone levels over a period of time because they may vary from one day to the next. In older men, affected organs may respond differently to androgens. Also, there is no one right level of testosterone for all men. You and your doctor need to work together to establish the level that's right for you. A testosterone level less than 200 nanograms per deciliter is considered low. If your total testosterone levels are over 600 nanograms per deciliter, then low testosterone is probably not the cause of andropause. A doctor will look at testosterone levels as well as other symptoms such as low sex drive and erectile dysfunction before making a diagnosis of andropause. What's the best way of measuring testosterone levels and diagnosing andropause? Opinions vary. The analog-free testosterone method is most widely used by large commercial U.S. labs. We feel that a more accurate measurement is either free testosterone or bioavailable testosterone done in a specialty laboratory setting. While there is some variation in what tests should be used, it's widely accepted that blood work should be done prior to 10 a.m. to capture peak values. Interpreting testosterone levels is complicated. That's why it's important to see a physician experienced in this field who has a relationship to a specialty lab. It makes interpreting the results that much easier. Treatment of andropause. Replacing androgen hormones in men. The good news is that once andropause is diagnosed, therapy is often very effective. The goals are to reduce the andropause symptoms, restore sexual functioning, increase libido and sense of well-being, prevention of osteoporosis by optimizing bone density, restoring muscle strength, and improving mental functions. Our aim is to bring your levels of male androgens and serum testosterone back to normal levels, but beyond this, to also normalize secondary hormones affected by testosterone levels. These include DHT and estradiol. There are a number of ways to treat andropause, including oral tablets or capsules, injections, long-acting, slow-release pellets, and transdermal, through the skin, patches and gels. We feel that replacement done through the skin is the most advantageous and is the method used most often because it's easy to apply, it's relatively safe with low incidence of side effects, it more closely mimics your natural body rhythms, more is produced in the morning, less as the day goes on. Treatment of andropause is most successful when you have an experienced doctor who understands male hormones and their functions. Low sex drive. There are a variety of treatments to improve low sex drive, low libido, in men. An experienced male sexual dysfunction medical professional can identify the cause of a low sex drive and develop successful treatment protocols. Role of androgens on men's sex drive. Androgens play an important role in stimulating and maintaining male sexual function. Testosterone is necessary for normal libido, ejaculation, and spontaneous erections. Low sex drive in men often results when there are irregularities in the production of androgens, male hormones. Low testosterone levels in men, a common symptom of andropause, leads to insufficient levels of androgens available to stimulate a man's sex drive and induce erectile function. Other factors contributing to low sex drive in men. Sex drive and hormonal imbalance may be attributed to one or a combination of physical or psychological factors. These include lifestyle, smoking, drinking, drugs, lack of exercise; psychological, stress, anxiety, depression; disease, diabetes, blood pressure, cholesterol, obesity; use of certain medications, antidepressants, antihypertensives, antiepileptics. A male sexual dysfunction specialist can identify the cause of the problem and recommend appropriate treatments. Low sex drive in women. Decreased female sex drive can also be caused by a variety of different factors. Working with a medical professional who specializes in female sexual dysfunction increases the likelihood of successful treatment. Low sex drive in women can be treated through a variety of different treatments, including hormone therapy.